Hello and welcome to Health Tech Builders. Here we explore the business of health innovation through real stories from leaders in the trenches, the wins, the failures, and everything in between. You will get insights and practical advice to help you build and lead in health tech. I am your host, Rodrigo Hute. Hi, hello. Today my guest is Nick Aubin. Nick is the CEO of Commons Clinic. Commons is a new model for specialty medicine. And today we are diving into one of the most ambitious plays in specialty medicine. In this conversation, we explore three big ideas. Firstly, how Commons is breaking away from hospital dependence. Secondly, the economics of bundled payments and AI-enabled operations. And then finally, Nick is going to share leadership lessons behind building a value-based health system from the ground up. Nick, thank you so much for being here today and welcome to the podcast.
Of course. No, thank you for having me. I'm excited to share some of the war stories that we have.
Absolutely. Thank you. Thank you for being here. So I want to start with the origin story because Nick, you have shared this publicly. That you shared a deeply personal story about your Uncle John's cancer diagnosis and how that experience, along with your family's own health journey, inspired starting Commons Clinic. So can you take us back to that moment and maybe share a little bit about how those experiences crystallized your vision for Commons?
Well, I think Commons didn't come out of the womb as a fully formed idea, but is ultimately the accumulation of experiences I've had in my career. And so when we started the business in early 2021, there's really two sides to the story. On one side, my parents were at the time in their early 60s, in the preceding decade, had, as many people do as they're aging, like a bunch of random episodes of care happen, right? Like my dad had double hip replacements, my mom had a microdiscectomy, she had carpal tunnel, like pelvic, a women's health procedure. My dad had a cardiac event that he actually got picked up on his Apple Watch. And they're generally healthy people, but as you age, shit happens, right? And what I found was that they were going to, the physician referred to them by like a buddy at the country club that my dad golfs at, or doing typical research, and they were going different places and getting various quality care, and it was all like relatively whatever, right? The other side of the story is, when the pandemic rolled around, my wife and I were living in LA, and as many of us saw, hospitals were chock full of COVID patients, but hemorrhaging money. And with my like little naive brain, I don't think I had ever in my professional career really viscerally seen how dependent the kind of hospital industrial complex is on high margin specialty services, and specifically elective surgical cases like total knee replacements, like spine cases, like cardiac cases. And it was really like, oh, I think I can go make a difference there. Maybe go ruffle some feathers and muck things up. And so on one side, I'm thinking, okay, there's an opportunity to build the brand that maybe has some loyalty for people like my parents, as folks age, and have these specialty things come up. And on the other side, there's this market backdrop of the hospital business model maybe not quite being so durable as you might think, right? When you put that together, that's where the concept of Commons, like, can we go build this specialty super group that has all of the best features of independence, the access, the patient centricity, the ties to your community, with a lot of the value of being a system and being a scaled player. And that's, having your own infrastructure, having, scale and rate leverage and all the things that can ultimately make a sustainable business. And that's how we got started. As you mentioned, a couple years into that journey, as we had already built one of the largest independent orthopedic practices in the region, we were starting to think about our next set of specialties, starting to think about how we could continue to grow, kind of expand the Commons vision. And unfortunately, my uncle John, as you mentioned, was diagnosed with cancer and passed away quite suddenly after that diagnosis, for something that really could have been caught, right? I had, outside of my day job, been testing a lot of the, kind of consumer focused early detection testing startups out there, and found I was kind of captivated by some of the growth that they've exhibited, but really left with some questions about how like what do they do if they find something? How do you take accountability for that patient? And so we started to experiment with some different approaches to, leveraging specialty diagnostics, specialty testing, scans, things like DEXA scans, calcium scores, more advanced approaches to imaging, to genetic testing, and how that could be congruent with our specialty business and really be a front door to that care. And has kind of turned into a really interesting but new service line for Commons that we hope can connect all of our specialties together. And so just to tie this story together a little bit, like I think that Commons and Commons getting started, Commons now 4 years in, launching new programs in Commons, I think in the future will ultimately reflect my collective set of experiences navigating the world of healthcare, and hopefully what we build reflects what a lot of families experience as well, and we can make a big change because of it.
Specialty medicine, it's a broad area in medicine. What and you mentioned or that you started off with orthopedics, but what problems are you really trying to solve at its core with Commons?
Yeah, I think in a market like LA, just to kind of bring this home, over 90% of the spine dollars, so the healthcare expenditure on treating spine maladies are spent in a hospital, right? Uh, that is in large part the issue, right? Hospitals are the most expensive place to get care. Hospital systems have used their market positioning to have the highest rates at the highest cost site of service for that care, and in doing so, have become the gravitational force by which specialty care is oriented in our community. And so, where that really puts patients is in the position to make really, like, oftentimes one of two bad choices. Either they can go to this expensive, confusing hospital system where they're going to kind of get, shot out the other end with a bunch of services and a big bill, and hopefully the outcome that they're looking for, but oftentimes not. Or you're going to be at a community practice that maybe doesn't have the resources, the infrastructure to deliver the quality and consistency of care that you need. And so we really think that we're creating a third option, one where you can trust in that quality, consistency, patient experience, but that also has the infrastructure to deliver the care that you need. So let's take that again, that example of spine. Like, if you want to change that paradigm where 90% of spine dollars are spent in the hospital, you need to own the physicians, ultimately get them out of that system. You need to have competing infrastructure to the hospital, a surgery center that can do, any range of cases, but specifically, the more complex ones can be, 40 to 50% cheaper than that same care at a hospital for the exact same thing. Oftentimes with better outcomes, faster discharges, all that stuff. And then three, you need to have a business model that, yes, gets rewarded for shifting that care out of the hospital and into a surgery center, but also gets rewarded for avoiding that surgery in the first place, right? And having an expectation that you're not just a surgery mill that doesn't care what that patient's indication is, doesn't care that that patient might be able to pursue a more conservative option. And so if we do those things, right, shift site of service, avoid surgeries, and then in the future, and today and in the future, pursue the more modern alternatives to the maximally invasive like version of that treatment, then we can save a lot of money, right? And our ability to do that for a lot of patients over a lot of different areas, we think can really help delever communities from an over-reliance on hospital infrastructure to be the central nervous center of their nervous system of their care.
It's very, very interesting, Nick. I was going to say that you touched on some of the most important issues in the health industry. And if you at Commons are solving a few of them or all of them, then you are radically changing how things are being done. So, for example, when I think about what patients want, I think about access. You mentioned about access. They want affordability. Not cheap, but at least affordable, and a fair price. You also touched on trust and outcomes. And some companies that I've seen in the health industry, they try to tackle one or two of those issues. It seems like Commons is trying to radically touch on all of these critical success factors in the industry, which is awesome.
Yeah, and like, listen, I think you look across the country and how many regional health systems are there, right? There are, in uncountable. I'm sure like Blake in hospitality could tell me exactly how many there are, but there's a lot of them, right? And so, like, the reality is, healthcare is local, and when you focus on building a lot of services for patients in a dense geographic area, right? Like, you can grow and you can make a big difference. We are using what we think is a more modern toolkit to deliver care that's maybe more oriented towards the future. The simplest way to think about it is we're just building a health system without a hospital, right? And if countless hospital systems throughout the country have been able to achieve that, we think we can too. But we're just playing a different, maybe business model game, and certainly a different care model game.
Most hospital systems are struggling with their margins. Like, how confident do you think that your model could be different from what the current status quo is?
Yeah, I mean, like, at the end of the day, operating a surgery center is dramatically more affordable than operating a hospital. And especially if that hospital has to have service lines that require subsidization, right? So meaning not every hospital department makes money. Orthopedics, cardiac, those make money, right? But other stuff doesn't, right? And so that's why you blend it out to, like, maybe on average 2% margins, and, like, if you're great, 10% margins. And I think that the reality is, like, surgery centers, ambulatory assets, they just have much better margin profiles because rent is cheaper, your operating costs are cheaper, you don't have 24/7 nursing, like, it's just cheaper to operate. And so, we are not a replacement for a safety net hospital. We are not a replacement for an ER. Like, that's just not us. But what we are doing is unbundling the hospital in many ways, and yeah, taking out some of their more profitable elements, and making them more affordable, right? Because we don't have anything else to subsidize. So I'm extremely confident from a kind of architecture of the business. Sorry, let me try to get this sun out of the screen.
Yeah.
I'm very confident in the architecture of our business being dramatically more affordable. If the question becomes, how confident am I in, like, a hospital's ability to deploy AI to get OpEx savings or to transform their business, and how confident am I in that same impact that's going to have on Commons Clinic? I'm less confident in, like, putting numbers to it, but at the same time, I am, and maybe this is just egomania, I'm very confident that we will be able to do it. No matter where, like, the benchmark chips lay, I'm very confident that Commons will be at the top of the heap from an execution perspective.
And in terms of positioning, you are positioning Commons as an alternative to traditional hospital hospital systems, and some of these hospitals are monopolies or duopolies. But what would you say? What would you say is your wedge and the single most powerful reasons why payers, employers, physicians would choose commons over traditional health systems?
Well, I would say the wedge is our physicians and our ability to attract physicians. So
Okay.
let's go back to, like, I already mentioned this patient choice, right? Patients have a choice between going to the hospital system or going to maybe a community clinic, right? Physicians have that same choice, right? Like, ultimately today there are two choices. In a market like LA, where Commons is, there really aren't large group practices. So it really is those two options. And so on one side, you have a physician that might be, by themselves having hung their shingle, or they might be in a small group practice that shares rent and shares some resources with their partners, but probably doesn't have imaging, doesn't have a technology team, doesn't have professional leadership, doesn't have great contract. Maybe one of the physicians has some surgery center ownership, but they don't have a true kind of vertically integrated high capability practice. They're on their own, they're on an island, right? And over the course of time have seen their income erode, have seen competition change. It's very difficult. We could spend an entire podcast talking about the woes of succeeding in independent medicine as a physician. And that's why you see many of those physicians, fleeing to join hospital systems or joining private equity-backed platforms. On the other side, you have the safety of a hospital system where kind of give up a serious amount of autonomy in your practice for more stable compensation. But at the end of the day, you have no equity in your practice. The health system owns it, right? And your job is to feed cases to the hospital. Like that's why they pay you. You can talk about physician autonomy all you want in a quarterly business review, but ultimately that's the business model. I think what physicians see in Commons is a way to restore equity in their practice, right? Like, we give them the platform to build their franchise on top of a Commons franchise, and so that comes down to, of course, compensation alignment, equity alignment, so physically owning Commons Clinic and owning and having profit share in different pieces of that. But very early on, to your question about the wedge, like, we were successful selling this narrative, right? And we were able to get a couple big hitter physicians, Dr. Eric Milstein, Dr. Sanjay Khurana, Dr. Hyun Bae, and that was really the beginning of a snowball effect of, like, physicians believing it. And so if you want to change things for patients in specialty care, if you want to create value for health plans, like, you ultimately can't do it if you don't have physicians. And if you don't have physicians, you don't have case volume, right?
Mhm.
And so I think that is that was our wedge and continues to be the foundation of our business.
So can you give us an example of how would you approach a physician, let's say an orthopedist? Let's say I'm an orthopedist and I have my solo practice, or I'm working with a couple of other physicians in LA. How would you explain the value prop for me to join forces with you?
Yeah, I mean, honestly, it's pretty simple. Like, let's say that you do like total joint replacements or a spine case. I say, like, how much do you get paid a case? The answer is going to be somewhere around like $2,000. Where do you do those cases? Oh, I do them at the XYZ hospital. Do you know how much they get paid on the facility side when you do that case? And the answer might be 40 grand, something that is many, multiples of what they made. And I say, okay, let's change that, right? We have, within our business, we can both be cheaper than that health plan, but capture all the revenue for that case volume that you control. The hospital doesn't control it. You choose where that patient goes to get surgery. And why are you getting $2,000 and the hospital system's getting $40,000? Why don't we come together, right? We'll be able to negotiate rates. I know we're going to talk about bundle payments and the value-based structure in a couple minutes, but like, we go to a health plan and say, hey, we can save this health plan money. Maybe it's 25 to 40% lower cost than the hospital system. So we'll do that same case for maybe $30,000, right? And in doing so, we can generate some revenue. We're going to share some of that with you, the physician, right? You're going to be a part of that entire P&L, not just that, like, tiny sliver that you're, kind of able to bill for in your private practice. So you're going to make more money. We're going to save the health system money, and we're going to save the patients money. It's going to be more affordable. If we can do that and also do it in a pretty clinic with great technology and like own the surgery center, all this stuff, just to make your practice experience better and your experience of working in that practice better, like, is that something you'd be interested in? Right. And I think, there's a little bit of this Robin Hood narrative to it, right? Where it's like, care is expensive. We can re-architect it and ultimately share it with the stakeholders that matter.
So essentially, you are building true partnerships with physicians. You're building a partnership with physicians, and then you're sharing profits and you're sharing savings also with payers. And
Yeah.
Yeah. In terms of, if we, moving on to the whole concept of bundled payments, what is transparent bundled pricing? What does that mean?
Yeah. So historically, in a fee-for-service world, right? I walk into a clinic with low back pain, right? And you maybe start with physical therapy and some conservative treatment, but there's going to be a point where the surgeon says, okay, we need to go pursue surgery. So you're going to get imaging, you're going to have a bunch of office visits, and then you're going to get surgery, right? And like on the day of surgery, that's a physician billing, an anesthesiologist billing, a hospital facility or surgery center billing, and then there's all this aftercare, and you get 15 claims from 5 different billing providers to get one surgery, right? When we talk about a bundle, it's pretty simple. It's, can you collapse that into a single payment, right? And say, okay, this total joint replacement's $28,000, this artificial disc replacement's $45,000, whatever the pricing may be. And so the health plan knows exactly how much it's going to cost. The patient knows exactly how much they have to pay of that, of that episode expense. And critically, like, Commons knows how much we're going to get paid. And we're also going to take on some risk and responsibility for that patient after they have surgery, that if they have a complication, basically put a warranty on it, right? And so it's this really simple way of aligning everyone around, again, a transparent price. Like, there's no reason to have all this crazy variation in care. And for us, it gives us, again, like, predictability in that price, the ability to control the entire patient's financial experience, and ultimately be selling them a clinical care program, not just a disjointed set of services that don't really have a roadmap or any kind of rhyme or reason from a product perspective. Yeah.
And how is it possible to save 20, 30, 40% per episode? I mean, I understand when you mentioned about like hospitals have to pay, more rent, or they have, some unprofitable businesses or divisions or areas. But how is it possible to realize that amount of savings?
I mean, it's honestly pretty simple, right? Hospitals are more expensive than surgery centers. Hospital systems that have any sort of market share have higher rates than everyone else, right? And so if you have high market share and high rates at high cost facilities, you drive high episode benchmarks, right? You drive high costs, right?
Yeah.
Our job is to be a high market share, affordable provider and shift folks out of that unaffordable bucket. And so, again, it's very, very simply that arbitrage. But, I think in a lot of value-based clinical models, they're really pay for improvement models. So there's like, hey, here's where I am today. Can I change the way that I practice to be 25% cheaper? And like that's just frankly not possible, right? What is possible is shifting market share. Our job is to attract physicians, attract patient volume, ultimately shift market dynamics so that more patients are coming to us than are coming to, the higher cost alternatives. So again, going back to that, kind of stat that I pulled out at the beginning of this conversation, if 90% of spine dollars are spent today in a hospital, if Commons is successful, that number becomes 75% in a market because we've shifted, some market, and then eventually, hopefully, more than more market share than that if we're really successful.
And in this case, how do you align incentives with payers? So I know that you have to be in, you're mostly in network
Yep.
in LA with the big payers. Um, how's that dynamic and negotiation with payers? And do they help in sending you patient volume as well, or do they say, oh, it's not up to me, it's up to the physicians who will send you the volume?
Yeah, I mean, like there's no silver bullet, but I think from a contracting and payment model perspective, I think we're on the same team, right? Health plans save money every time a patient comes to Commons versus, one of the higher cost alternatives in their market. And so whether they're paying us fee for service or through a value-based contract, at the end of the day, like our goal is always to get a sustainable rate that can, incentivize our physicians to be part of Commons, that Commons can make enough profit to be interesting, and that the health plan can save really meaningful dollars. There's a million ways that you can contract that. It all just ultimately comes back to how much are you paying us, right? And they need to believe in paying us for the job that we are doing, which is delivering really complex, hard to do care, but also shifting market share, right? We're about to jump into that something.
No, I was gonna say that. So if I'm a payer and I know that if my members go to Commons, I will see 20-25% savings. So I have an incentive in channeling or guiding my members to go to you instead
Yeah,
of one of
yeah,
the big
totally.
hospitals. So do they have an incentive in telling their members, hey, by the way, before you do X, I would encourage you to go to Commons instead of a big hospital? Or maybe they don't get into those discussions because they already have entrenched relationships with these large hospitals? I'm just trying to,
So, yeah, I
you
mean,
know?
again, we could do an entire podcast on like how health plans can or should steer volume. The vast majority of our business is in the commercial market, right? So these are people, largely between the ages of 40 and 65 that have commercial PPO insurance, which basically means it's an ungated product. They can choose whatever physician, whatever service they want in the market. Um, this answer could be very different if we were talking about a Medicare Advantage plan that's an HMO and has very tight controls over referrals and what physicians patients have access to. But we're competing in the open market. What a health plan can do for us is one, pay us appropriately so that we can incentivize physicians, and our ability to continue to get great physicians to join our platform by definition means that case volume will be shifting out of incumbent environments and into commons. Two, we work with a lot of employers as well directly, either through their health plan, through a center of excellence partner like Carum Health, or directly, and they can do things like change plan design and market and like be much higher touch from a navigation perspective to send patients to commons. I think most health plans, especially in the traditional commercial market, are not super effective at driving meaningful volume. They can send mailers, they can do a bunch of stuff, but it's really Common's job to drive that market share shift, and like that's kind of a known. Um, if a payer could really deliver us a deluge of volume overnight, call me. We would love that.
So you mentioned earlier in the conversation that Commons is vertically integrated. Can you talk a little bit more about that? What does that mean?
Yeah, so like at the end of the day in healthcare, the things that make money look like technical and facility services. So meaning uh, it's not just selling a physician's time, but rather doing things like imaging, doing the physical surgery, and like having the operating rooms and those things. Those are the things that make money. So in a private practice construct, that physician is basically billing for their time, right? And so it's not that different than a lawyer or any professional services, right? That's very, very hard to make money on as a company and platform like Commons. So our approach is saying, okay, that physician, that's their money to keep. That's how we pay them, right? It's our job to then add ancillary services, so things like physical therapy, durable medical equipment, imaging, testing services, all these different wraparound services, the surgery center, and the capabilities to actually physically do, hospital complexity cases outside of the hospital environment, a surgery center. And then, of course, there's wraparound services like virtual that we can deliver, right? Our ability to be a one-stop shop is ultimately our ability to monetize that episode of care. And it just so happens that if we are monetizing that episode of care effectively, the patient's gone through the clinical model effectively, and we've saved the health plan money because it's happened outside of the hospital.
But also, vertical integration can potentially add additional risk, complexity, and cost to your model, right? So how do you balance the benefits of integrating vertically with all of the complexity? It becomes also more capital intensive, right?
Yeah, I think that I don't know that I have a great answer to that other than I think businesses can either vertically integrate to simplify the value prop and extract kind of more value out of their customers, or they can be horizontal pieces of that to effectuate the change that we want from a cost of care perspective, from a patient experience perspective, from a physician experience and economic perspective. You can't accomplish that without vertically integrating, right? And so for us, it really then becomes an exercise of capital allocation, timing, and putting those pieces together at the right time to build the proof points that we need to continue funding the business and get to the next stage. I will say though that these are big underlying trends in healthcare, things like this big ambulatory shift, and so we feel like we are catching the right wave at the right time. And if we have continued support from our investors, from our physicians that want us to do this, from team that wants to work on this problem, that's ultimately what you need to make vertical integration work over the long time. It just ultimately needs to be built into your DNA.
Right. And so in terms of market expansion, you mentioned that you guys started in Los Angeles, and but you're targeting to expand to 8-10 cities across the US. Is that accurate? And
I mean, in the fullness of time, sure.
yeah,
The first job to be done here is be really important in Southern California, right? I think today we are, my mom thinks we're important. We are, we are one of the largest independent groups in California, and certainly, the largest in our area of Southern California, Los Angeles. But LA, Southern California, the markets that are attractive to us can support, physician groups that are, 10 to 20 times the size of what Commons is today, right? And continuing to scale in our markets really helps us scale value for consumers because there's, more services, more access points, more commons available to them. From a payer perspective, we continue to help them delever from the hospital systems by, again, more access points, more patients going through this, our care model and not others, and then ultimately more infrastructure, right? Like we can own more of that. So I think again, the first job to be done is build something really great in LA. With that experience, I think we're really well architected to go into major markets that look like LA. Maybe that's New York, maybe that's Houston, markets like that, where they have similar problems. High hospital system concentration, very fractured independent physician communities, and a real opportunity to, again, build this kind of specialty super group and fill that void and create a lot of value.
Yeah, that makes sense. I agree with you. Healthcare is very local, and you have a lot of opportunity in one, in one big city, in one state. And there is a saying in in the VC ecosystem that says like nail it before you scale it, right? And
Yeah.
there is still a lot of opportunity for sure. And I wanna go back for for maybe a minute to keep talking about physicians and the partnerships that you build with physicians. What else have you found uh, helpful in building relationships and partnerships with individual physicians to join your mission, join your partnership, retaining the best possible caliber of physicians in the group, attract and retain? So what else, if you spend maybe a minute, what has been your playbook and what are some of the things that have worked in building these relationships and partnerships?
So I think one is I think we have restored equity to their practices. And I mean that um, in terms of like how we compensate them, right? Each of our physicians has their own P&L, like they are their own franchise owners within Commons. But they also are investors in Commons. We've taken in, millions of dollars of investment from our physicians to own, Commons Clinic, the management company. They have also invested in our surgery centers. Our physicians are truly invested in the platform. Like it is their company, and as much as it is mine, as much as it is our investors. And I think we've created a bunch of smart incentives there for them to really care about what they're building. Um, Two is, this is not just a hodgepodge of folks that like Nick and my co-founder Paulo have cobbled together, right? We found basically the first one or two, and then they found each other, right?
Hmm.
And our physicians really curating and being the best recruiters for Commons has ultimately meant that the people we've brought together were all friends and colleagues before Commons, and we've really facilitated them coming together to build something in their vision, right? And I think that that's been really important, and not letting growth get in the way of maintaining that culture, maintaining that collegiality. Like I think that when I think about the biggest brands in healthcare and think about folks like the Mayo Clinic, Cleveland Clinic, HSS, MD Anderson, like these great names, they're at the end of the day, they're about talent density. They're about getting great physicians that respect each other, want to do research together, like believe that their brand is more powerful collectively than individually, right? And I think that that's been really powerful for us. And then I think that they believe in the positioning of the business, right? And that's pursuing value-based reimbursement, vertically integrating, being able to do these things at a scale and sophistication that they believe can help them be competitive for a long time. I would say it's really those three things together that has been the core of our kind of value prop to physicians, and then build pretty clinics, and people like being in pretty spaces, but that's a little bit more trite.
I love what you said about building talent density, and I would agree with that 100%. Let's move on to, I cannot have a podcast these days and not ask about AI and,
Yeah.
and what AI is doing. But you have talked about embedding AI across physician workflows, customer service, surgical operations, and so on. Can can you share a concrete example where AI is already improving efficiency or outcomes at Commons?
Yeah, what's interesting in healthcare right now is that it feels like every use case is known and has 15 vendors already popped up. So things like like the ambient scribe industry has been a rocket ship. Companies like Abridge and Nabla and DeepScribe and so on and so forth, helping turn clinical conversations between a physician and a patient into structured clinical notes that you can bill for. There are companies that are focused on, the AIification of the billing stack. Can I take that clinical note and code it, submit the claim, manage denials, all that stuff. Of course, there's this, other side where it's like, can we take all these documents and summarize them together and make them useful for a clinician or a care management use case? And so we know all these use cases, right?
Right.
I think Incommons knows these too. We went on a journey basically, doing a broad RFP to look at all these things, right? Like who's the best at it? Like, are we missing something? Is this all really hard? Like why are there point solutions popping up for each of those? And what we came to the conclusion of is if you know your workflows, if you can control your data, and if you believe foundationally that foundation models are going to continue to do the vast majority of the work and be the key engine here, you're in a pretty interesting position to build it yourself and consolidate all these use cases together. So that's what Commons has done. We've built our own interface for our physicians and our clinical teams to use that takes a lot of the use cases that I just talked about and consolidates them, right? We are on a single EHR, right? We control all of our data. We have over 1 million, documents and pieces of information on our patient population, right? That we can feed into a foundation model. We know exactly what we're doing. Like we know, when we want to summarize that patient's clinical record, like at the end of the day, we know what our physicians want. Like I can write a 12,000 line prompt as well as anyone else, right? And so by consolidating these, I think what we're finding is we may not have the slickest UX of anyone out there
Mhm.
just because we're not in the business of commercially selling this externally. But what we have found is we're in control of our own data, in control of our own workflows, and can be extremely nimble to the demands of our practices to spread AI across the full surface area of our business, right? As fast as possible and iterate really quickly. And so, again, I mentioned earlier, like I don't know if this means we're going to have 500 basis points of expansion, 1,200 basis points of expansion, or a single basis point of margin expansion, right? But I do know that it's making us faster, it's making us more efficient, and as we scale, I think it will increase our service quality, increase our access, and hopefully, yes, impact our margins in the long term. But we've made the decision to put our faith in the hands of the smart people at Gemini and OpenAI and these companies to help us along that journey, rather than the middleware vendors that I think we could have chosen to abdicate that responsibility to.
I want to ask you a question about private equity. And private equity platforms are rolling up specialty practices nationwide. It's a trend, and we are seeing that. Two questions for you. The first one is like, how do you differentiate, Commons from the traditional PE model? And secondly, like, are there any aspects of the PE playbook, whether it's capital efficiency, incentive design, blah, 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 that you have intentionally borrowed to include as part of the way that you run things at Commons?
Yeah, and I mean, I think to try to pigeonhole private equity into a single model would be a disservice to, I think, the diversity of like approaches that private equity businesses have. But what I think you're really asking from like a roll up perspective versus a staff model, like at the end of the day, like a private equity backed business exists on a spectrum. On one side, the product being sold to a physician or someone that would be rolled up is financial, right? Like, is this basically a financial product where I'm going to give you money so that I can get a management fee out? That would be the canonical scrape model, which I think is the least valuable approach to building value in healthcare. It can maybe be financially predictable and financially valuable from your ability to aggregate EBITDA, expand multiples based on that aggregation of EBITDA, and then sell it to someone. It works really well when you're aggregating drug volume and selling to a distributor. In other specialties, maybe it doesn't work so well. And on the other side of the equation, if side one is these financial products that a private equity fund can create, so liquidity products. On the other side, there are products and brands, right? And I think that we want to sit on the product and brand side of the equation, right? I believe that real intangible business value is created when you build a great product that people want, and you can build a brand around it that can
Mm.
create a franchise for a very long time, right? And so that being said, we need to be competitive in the dynamic that those financial products have set, right? Those are, return on capital expectations for, for funds and LPs. It is, competing with, a physician getting a big payday rather than joining a different model, right? And so we need to, certainly rotate there. There's aspects of our model, like buying surgery centers, that, if it ain't broke, don't fix it, right? Like there's no reason for us to zig when others are zagging. I think where we are most different is like we are not a give physicians a bunch of money up front and scrape their income with a management fee going forward. We are about building an aligned long-term partnership, as we've discussed. And I think, if physicians are invested in us and we're invested in them, and then it's symbiotic, and we are building that product and brand together, we think that's how you build a durable franchise.
Super interesting. Nick, let me move on to the next to the last section of our interview today, and I want to spend a couple of minutes talking about your experience as a CEO at Commons, and perhaps you can share some of the lessons while building Commons. And you have been scaling the company now for 4 or 5 years, I think. It's a fast-growing company, and I wanted to ask you, like, what has been your toughest leadership lesson so far?
Oh man, I think well, I separate the role of the founder kind of in two. Like a lot of what founders of companies do is single player mode, right? And what I mean by that is like it's your job to write the pitch deck, come up with a story, go pound the pavement, raise money, hire a team. Like, it like a lot of the early days of a company is about your sheer force of will and charisma and and all that stuff. And the other side is of course being the leader of people, right? And being there for them and setting the direction. And I think that, one of the hardest things for me, at least, I don't know about others, is balancing those two sides, right? You know, I'm the type of person that can really lock in, right, on one side, right, and totally ignore everything else going around me. Let certain fires burn because like I've got that one thing that I need to go do, right? And so being able to, just like see the entire playing field and have that full perspective, I think for me is something that I need to like remind myself of every day. It's like be well rounded in the way that I'm managing this company and kind of giving myself to the company so that we can be most successful. But I also think that being a successful founder, other than having the technical and tactical skills to do so, is like what is your capacity for pain at the end of the day, right? And like there could be good pain and bad pain, but like at the end of the day, it's pain, right? Like this is I am training for a marathon right now, so this is funny timing, but like the most impressive athletes in the world are elite marathoners who are running sub 5 minute miles for 26.2 miles, and their capacity to manage a lot of pain for a long period of time ultimately is what makes them great. And I've never met a successful founder where that was not true, and so I strive to embody that as well.
What have you learned in terms of how to be able to expand and tolerate the pain threshold that you were just referring to? I mean, are there any practices or habits or things that you have learned from athletes or other founders that you have been practicing to be able to, cope with that pressure, pain, whatever you want to call it. Because I agree with you that founding a
Yeah.
company, being a CEO, you have this roller coaster ride, and a lot of it, it's quite painful.
Yeah, a few things come to mind. The first is like sunshine is the best disinfectant, right? Like when I say it feels like single player mode, making it multiplayer mode is like the thing that I find young founders and young Nick make the most mistakes. Like if something goes wrong, like tell your board immediately, like get their help. Don't like hide it for a month and like hope it like magically goes away. Because like if someone has given you money, like you guys share the same incentives. Like they want to solve it too, right? And I think that that's something that I've really learned over time to like engage the people that care about this company faster. Two is and it's very apropos saying this to the YPO community. I've really been very thankful to have a lot of mentors in my career, but like a couple really close friends, um, who like deeply respect their opinions that are, like a click past where we are, like in some cases having sold businesses for a lot of money, in some cases just like a couple stages further. That when I'm like sitting in my office trying to figure out like what the next thing is, and I don't have any ideas, and like I just need to like kind of reinvigorate myself. There is nothing more like gratifying than like riffing on that with someone that you like deeply respect and trust, but can also like have the openness of a therapist, and is not gonna like and has no incentive in your business, like doesn't like cares about you, doesn't care what happens, right? To kind of give you that advice, so that kind of cobble. But so I guess in both cases, that coping mechanism for me has been like don't retreat, like engage, and like ask for help, right? One of the hardest thing is you know when you start a company, it is inherently driven by ego to do so, right? You have ambition, you want to achieve something, you want to build something, what have you. That same, I think, ego that can drive you to do something can also have the negative externalities of not asking for help and not being receptive to help. And, I definitely think that as I've grown, maybe more experienced, a little, hopefully more mature, I've been a lot quicker to ask for help because it is just that helpful.
Absolutely, I 100% agree with that. Um, to close, Nick, two more questions, and one, it's about how do you keep learning while being in the midst of it? And you're the CEO, you're a founder, you're building a company. It's 24/7, and with all of the pressures that we already discussed. But at the same time, most founders, CEOs, and C-level executives, we are always trying to learn more. And right now, it seems that the world is changing a lot with AI and all of these new tools, and it seems that it's never ending. So how do you keep learning? And what and then the last question is like, how are you using AI personally and professionally to improve your life and your work?
Yeah, I think the best way. Oh man, how do you learn? This is I don't know that I've ever I don't think that I will be able to answer this question succinctly at all. I think that my media diet is a lot of PDFs that I find or fall off the back of the trucks from kids or from friends, excuse me. So like there's nothing more like gratifying in my life than like, hey, a friend sends me this like a pitch deck of another company in the space, or a contract that like could maybe jog an idea, or like sends me a demo or something like that, and like you curate this like flow of information that's like really interesting and novel to you, so that you can build up your toolkit and just be very kind of like hyper aware and and open to things for a healthcare business that has a lot of contracts, a lot of like business model, like kind of interesting things, that could be very helpful for me. From a technology perspective, you have to, I don't know, like maybe be like a little addicted to Twitter and just be, just get a lot of uh joy out of the podcast and the Twitter sphere, just because it's like, and for me, like I'm not, a straight up technology founder. So it is a little bit of escapism, like learning about areas that I'm very interested in, and like obviously has some congruency. And then to your point, like being a user, like I tend to not be a broad user of many, many things, but I would say I am a like, absurd hyper user of ChatGPT, as many of us are. And so I think I'm just using it a lot.
Yeah.
I don't know. And it's always like the first pass. Like I don't wait to have people do work for me anymore to like get the answers that I want. I take a first pass and I see how good it is, and I think, as we all have, we've learned, okay, maybe it's good, maybe it's bad in certain cases, but like, okay, I now know what first my junior employee would do here. Now let's figure out what, like, the next level is, right? And then I can decide, like, okay, do we need to invest resources into it? But like ultimately just like constantly consuming, whether it's ChatGPT outputs to podcast to Twitter to, like, again, maybe some more of this like in this industry specific like PDFs and contracts that fell off the back of a truck. Like all of this, I think, is ultimately just like an information diet that if you have the right personality and motivation, you can hopefully then apply.
Yeah, absolutely. Nick, thank you so much for your time today, and thank you for sharing your journey with Commons.
Of course,
Congratulations, you're
thank
building
you.
an amazing company, and I wish you all the best. So
Appreciate it.
thank you for joining us today, and thank you to everyone else who is watching and listening. Until the next time, thank you.
Thanks.